Good evening. One of the things that I wanted to share with you today is a little bit about the Millen Method, which I can kind of consider the optimal physical therapy integrated with clinical fitness. Heavily influenced really by more of an Eastern philosophy, which is really looking at the body as a whole as opposed to parts. What we often do is we often treat the parts. We end up treating different pieces along the way, and I get to be a shoulder guy, a knee guy, a hip guy, and all those kinds of things. The problem with that is the body doesn't function that way. Although there may be a bone in your foot that's out of place, not functioning well, it's not moving properly. What most people don't realize, it also influences the knee, and it also influences the hip, and also interferes with how the back functions, all the way up to your neck. So often, if I think somebody comes in with a neck issue and I don't look at their feet, I often miss the problem. I often miss a piece of what's going on because I get hung up in the parts. Kind of the whole forest and the trees analogy. If I think too much about the forest and I miss the trees, then I end up missing something. The same thing's true if I think of just the tree and not the entire forest. You have to put Humpty Dumpty back together again at some point in time. And the nice part about physical therapy, at least the way we practice here at Impact, is to make sure that we look at you as a whole, not as parts. It's important that we recognize expertise and developing expertise, but I've often lost patients because they say, hey, you're not a shoulder guy, you're not a shoulder specialist. Well, I probably treated thousands of shoulders in my 30 years of experience, but I wouldn't consider myself a shoulder guy because the shoulder has to attach to something to be important. And if I miss what's going on at the shoulder joint, it's one thing. But if I miss the fact that, hey, I may be painful in my rotator cuff, but if it's because the shoulder blade is not moving properly and not controlled properly by the muscles, well, that's a whole other thing. And if it's because of the way the lines of force are, that the opposite hip is not functioning well, and they're putting too much stress or load on their shoulder because of that, if I'm a shoulder guy, then I would miss looking at the hip, because I don't look at the hip. I've also had lots of shoulder guys who don't work on the spine. Well, if I don't understand how the thoracic spine, and the cervical spine, and the lumbar spine integrate with the shoulder, then I'm going to miss the essential problem. Because it's not that there isn't stress on the shoulder that's causing pain. It's because the back is not functioning properly and it's overloading those structures. So in treating the shoulder, we treat the back, we treat the hip, we look at your feet. We want to make sure that all those parts are working together. Again, looking at the body as a whole as opposed to parts.